Hello and welcome to my podcast. Today I am kind of down and out because I went to the dentist and my face was really swollen when I woke up, and I thought I was going to be like this all day, but I'm not. So I'm back to normal. It made me swell up from all the way down here. I guess I'm allergic to the shot that they give you before they numb you, and I'm going to tell my dentist next time I go in there that he's got to use something else. I'm sure there is something else, but that is today's stories for you about the dentist. So let's get into the stories and jump right into it. This one said, I worked in a small dental office back in 1992 to 93, where the dentist did not autoclave the instruments. Everything was cold sterilized. Once I came back from lunch and was advised to take the morning instruments out of the prepare the trays, and then for the afternoon, once I tried to use the autoclave, but was scolded by the office manager, and I worked there 3 months before I was moving on. Sometimes these dentists, man. I keep seeing the worst pictures on here of teeth. This is tripping me out a little bit. Anyway, it's making me want to gag. It's disgusting. This one says a lady. Okay, I already read this. So this one says a lady arrived at the dentist and went to the front, and she had a tooth in her hand, and so the lady in the front was like, what happened? She goes, this is my husband's tooth. It fell out. Can I put it back in? And the lady's like, it did not just fall out like that. You're not telling the truth. And she just looked at her like, whatever. And then she was spinning the tooth on the counter with her finger, like spin the bottle, she said. And then the lady was just really rude to her and wanted her husband's tooth fixed. And the lady was trying to tell her that she was going, what she was going to do, but that she just turned around and walked away for no reason. Right? And then after that, she just sprayed the whole entire counter, the doors, everything with some sanitary stuff. And the people in the office were like looking at her like, why are you doing this? And she had to explain to them what happened. So this next one said, I worked for a guy who used to put HVE suction tips in a cold, sterile, and she sighed, and I wanted to die. I always threw them out, and he never knew. Are they supposed to go in like hot, sterile stuff? I don't know. If you're going to the doctor, just freaking make everything sterile. You can't just do that to people. That's disgusting and gross. This one said, we had a hygienist who was explaining to the patient how properly to use his electric toothbrush. He just laughed at her and said he never used it to clean his teeth. He told her he only used it to pleasure himself. That effectively ended the discussion. A man did that? You guys. All right, listen. Some of the conversations in the dentist office when they are doing your teeth and they have your mouth open, you're like, why in the freaking hell are you talking about this in front of your patients? Or why are you telling us about what you ate or your friend's relationship or what happened in the office? Like, are you that bored? And then you want to talk oh my God. And then you want to talk to the patient with tools in their mouth. And then you're like, oh yeah, this and this and this. And then the person's like, like, and then they're like, what? And then she's like, oh, sorry. Or is like, oh, sorry, I shouldn't be talking to you while you have this stuff out or in your mouth. And that's what I meant to say. And then then they'll laugh and then they'll continue their story. I heard some drama the other day at the dentist. And a couple of times I have laughed while they were doing that. And they were like, you don't even know these people and you're laughing. I said, I've experienced things like that too. I've had coworkers before and I had friends and I know what it looks like when you're in drama time. So I don't want to know what you're eating. I don't want to know why you're doing certain things and you come back. Just do your job. All right. This one says toothbrushes with coarse pumice were used on heavily plaque food debris in the mouth prior to dentist treatment, fillings, crowns, and whatever. Then rinsed, put in the ultrasonic, then in cold disinfectant and reused. Yuck. I was reprimanded by throwing some away. Needless to say, I wasn't there for a long time. There's no way I could be a part of that sleeping at night. The doctor felt he was okay doing this and was not going to make any changes. I cringed at the memory. Yeah, sterilize your stuff, dentist. This one says, how about the dentist finding old... Okay, this one says that they found antique instruments at an antique store, sterilized them, and reused them on a patient. That's disgusting. And I don't like seeing that tooth. That's gross. And I was scrubbing a huge... Okay, this one says they were scrubbing a huge stain on the ground, and the doctor walked in and said, haha, you're not going to be able to get that up because me and my wife were having sex and it was a bottle of lube and you're never going to get that out. And that's disgusting. Don't do that either. Tell people that stuff either. That's gross. I'm not saying sex is gross, but I'm just saying in the office. That reminded me of when I was watching Family Guy and he's like, in the kitchen, Meg. I don't know why it just reminded me of that. This one said, I filled in for another assistant. She had prepared the room before leaving. Well, the doctor used a mirror and retracted the lip in the injection. We both noticed that on the back of the mirror was covered with impression material. The doctor became angry and I had to dodge the instrument as it came flying across the patient's head and hit the window behind me. Oh, wow. Angry doctor. I worked for a dentist who would give a drunk patient nitros. He said it was okay. One time, she inhaled a crown and gagged on us. Another time, she puked all over me. Yuck. I left the patient and I loved the practice after that day with the patient. And I never went back, and I heard she died. Not sure of the real reason why she died, but I have my ideas. The dentist killed her. I'm just kidding. I'm sure this lady was drunk somewhere and something happened to her, but whatever. Oh, man. That's terrible. Says, my boss was being divorced and was an emotional mess. He hires a woman who said she was a certified assistant, 15 years experience. She was certified to take x-rays, but was I cannot say those two words. And she was sexually harassed with our male patients, unwilling to learn and rude to the hygienist. Ultimately, she whispered to a patient that she should leave the office because the doctor was just trying to get money from him. The doctor finds out and fires her. She files a suit with a National Labor Regulations Board who found that she was fired unjustly. Oh my God, I would have fired her sooner than that. This one says, I once worked in it's a pediatric clinic that had a dentist who proudly sported a no crying button on his jacket, wore earplugs during procedures. One assistant had to leave the operator in the middle of the procedure because she didn't want to vomit in front of the crying child. Of course, we assured the patient, who was not allowed in the back, that her kid was well taken care of. And I do not like this picture, so I'm going to cover it while I read. An older guy an older guy came in and wanted his niece's dentures to be realigned to fit it for him. Sorry, this picture is like making me grossed out. So this guy came in and asked if his niece's dentures could be realigned so it can fit him. That's disgusting. Teeth are disgusting, guys. You need to not mess with that. Okay, this is where you first digest your food, for one. There's teeth in your mouth that are not yours and nastiness in there. And this is why we brush our teeth every day. You know, so I just got my braces off. So my dentist is refixing my teeth, what the braces did. For some reason, if I would have known this, they did some weird thing to my teeth and I do not like it. So they're refixing it and they're fine, but they look good. But I guess the doctor said that they need to be a certain way and they're fixing it. But whatever the orthodontist did to my teeth. But anyway, this one says the doctor's mother had come in for dental treatment. The patient had generalized advanced periodontal bone loss. To relax in a chair, she would place a 2x2 gauze square over her eyes and meditate. The doctor asked me to obtain the maxillarily permanently aligned impression. As I removed the impression from the patient's mouth, I realized both maxillary certain scissors were now missing. Oh no. I quickly checked the impression, and to be an absolute horror were the doctor's mother's two maxillary certain incisions sitting in the alignment impression. Oh no, poor person. My goodness. This says, throughout the dental industry, it has made significant strides in adopting new technology. It still has a long way to go before reaching its full potential. Historically, the industry has been struggling to embrace innovation, with a large percent of office slow to move off paper charts and film x-rays. However, today, we see promising developments such as diagonal records and AI-assisted diagonal records with enhanced patients outcoming and patients experience. Despite these advancements, to adopt the modern technologies such as cloud-based practice management software remains relatively low. Estimates are only 10 to 15% of practice and have made switching compare up to 90% in other industries. Yeah, so what I was saying is I just got my braces off, and so I guess when you have metal braces, you can get Invisaligns, and I didn't know this because, yeah, you guys can kind of see that I'm a little bit swollen still. So please forgive me for that. And I'm trying my best to talk to you guys while doing this video. So I guess the braces do something to your teeth, and the dentist has to go back and repair it. I didn't know that for the longest time until the dentist told me. So that's what I'm going through right now. So they're repairing what the braces did to my teeth. Anybody out there have any horror stories with dentists? The numbing is disgusting. The stuff they put in your mouth to numb you is really gross. It tastes nasty. They're like, oh, here you go. Here's bubble gum. And it does not taste like bubble gum. A couple of times when the guy put the shot in, I could feel it. And a couple of times where it dripped on my lower lip and it was numb because you're putting inside your lip and that's not where he was supposed to put it at. This last time there was water spraying all over the place. Thank God I was wearing glasses. So that is my stories today about going to the dentist. So I just want everyone to know that I don't just talk about the paranormal, but that's where it's leading to, because I know that best, if that makes any sense. I've seen some weird stuff, heard some weird stuff, and been around some weird stuff. So the other day, I was getting ready for bed, and I saw this big shadow come out where my clothes were and went up into the other room, and my cat followed it, you guys. I am not joking. She followed that whole thing. It was not a bug. It was nothing. It was a shadow. She followed it out to the other side of the room. And I asked her to come back to me, and she would not stop looking at where it was, like she was looking up at where it was last night. This freaked me out, you guys, but I can't let it freak me out, because if that's what I'm going to be doing, then yeah, I can get scared. But I want to go into the paranormal, but I do talk about other things. I talk about crazy stories, scary stories, spooky stories. I talk about anything and everything. I will take you guys to the store and show you stuff. I'll take you guys to the theme parks over here. I'll take you guys out to the other day we went and filmed at a place called Bowl and Pitcher, but my camera died and my phone died, and then I lost half of the footage. So we're going to go back out there, and I'm going to record for you and put it back on here before it gets too cold. We're going into fall, so it has been 100 degrees over here for the past whole entire summer until now. It like totally changed into fall season. Everybody wants their pumpkin spice lattes. I'm not a pumpkin spice latte person. I'm not saying anything bad about that, but yeah, I hope my talking was okay for you guys, and my swollen face, you can tell a little bit from going to the dentist the other day. Oh my God, I woke up and I was like, what is happening? I was like feeling my face, and I looked in the mirror, and all right here and all the way down, it was like this. So I was like, is this what it's going to be like for the next couple of days? I want to film, and I want to do my podcast and talk to you guys. So anyway, thanks for listening to my dentist story today, and I hope everyone has a great day and a great night and the rest of your week. I want to thank everyone for watching, and peace out, everybody. Bye.